Hello and welcome to this video on schizophrenia. Schizophrenia is a serious mental disorder that affects millions of people worldwide. It is a chronic condition that can be challenging to manage, but with proper treatment and support, people with schizophrenia can lead fulfilling lives. In this video, we'll be discussing the symptoms, treatment options, and coping strategies for schizophrenia. Symptoms. The symptoms of schizophrenia can be broken down into three categories: positive symptoms, negative symptoms, and cognitive symptoms. Positive symptoms are behaviors that are added to a person's behavior, such as hallucinations and delusions. Negative symptoms are behaviors that are taken away from a person's behavior, such as lack of motivation and social withdrawal. Cognitive symptoms are related to a person's thinking and reasoning abilities and can include difficulty with concentration, memory, and decision-making. To expand further on the symptoms of schizophrenia, let's take a closer look at each category. Positive symptoms. Positive symptoms of schizophrenia involve experiences that are added to a person's behavior. These symptoms can include hallucinations, delusions, and disorganized thinking. Hallucinations are experiences of seeing, hearing, feeling, or smelling something that isn't really there. For example, a person with schizophrenia may hear voices that others cannot hear. Delusions are false beliefs that a person holds despite evidence to the contrary. For example, a person with schizophrenia may believe that they are being followed or that the government is spying on them. Disorganized thinking can make it difficult for a person to communicate effectively, make sense of information, or organize their thoughts. Negative symptoms. Negative symptoms of schizophrenia involve behaviors that are taken away from a person's behavior. These symptoms can include lack of motivation, social withdrawal, and decreased emotional expression. Lack of motivation can make it difficult for a person to initiate or sustain activities. Social withdrawal can make it difficult for a person to interact with others, form relationships, or participate in social activities. Decreased emotional expression can make it difficult for a person to show emotion or respond appropriately to social cues. Cognitive symptoms. Cognitive symptoms of schizophrenia involve difficulties with thinking and reasoning. These symptoms can include difficulty with concentration, memory, and decision-making. Difficulty with concentration can make it difficult for a person to focus on tasks or follow conversations. Memory problems can make it difficult for a person to remember things or learn new information. Difficulty with decision-making can make it difficult for a person to make choices or plan for the future. It's important to note that not all people with schizophrenia will experience all of these symptoms, and the severity and type of symptoms can vary from person to person. It's also important to note that some of these symptoms can overlap with other mental health conditions, so a proper diagnosis is essential for effective treatment. If you or someone you know is experiencing symptoms of schizophrenia, it's important to seek help from a mental health professional. Treatment options. There are several treatment options available for schizophrenia, including medication, therapy, and support services. Medications such as antipsychotics can help alleviate positive symptoms, while therapies such as cognitive behavioral therapy can help with negative symptoms and cognitive symptoms. Support services such as case management and peer support can also be helpful in managing the condition. Let's explore the various treatment options available for schizophrenia in more detail. Medication. Antipsychotic medications are the most commonly prescribed medication for schizophrenia. These medications work by blocking dopamine receptors in the brain, which can help alleviate positive symptoms such as hallucinations and delusions. Antipsychotic medications can also help improve negative symptoms such as lack of motivation and social withdrawal. There are two types of antipsychotic medications: typical and atypical. Typical antipsychotics are older medications that have a higher risk of side effects such as movement disorders, while atypical antipsychotics are newer medications that have a lower risk of side effects but can still cause weight gain and metabolic issues. Therapy. Cognitive behavioral therapy, CBT, is a type of therapy that can be helpful in treating negative symptoms and cognitive symptoms of schizophrenia. CBT can help a person with schizophrenia learn coping skills and strategies to manage their symptoms, improve their communication and social skills, and challenge negative thought patterns. Other types of therapy such as family therapy, individual therapy, and group therapy can also be helpful in treating schizophrenia. Support services. Case management services can be helpful in managing the various aspects of a person's life affected by schizophrenia, such as housing, employment, and financial assistance. Peer support groups can provide a safe and supportive environment for people with schizophrenia to connect with others who understand their experiences and share coping strategies. Other support services such as vocational rehabilitation and social skills training can also be helpful in managing schizophrenia. Treatment for schizophrenia is often a combination of medication, therapy, and support services, and finding the right combination for each person can take time and patience. It's also important to have a supportive and understanding network of family and friends to help manage the condition. If you or someone you know is experiencing symptoms of schizophrenia, it's important to seek help from a mental health professional. Coping strategies. Coping strategies are essential for people with schizophrenia to help manage their symptoms and improve their quality of life. Some coping strategies include maintaining a healthy lifestyle, such as regular exercise, eating a balanced diet, and getting enough sleep. Engaging in enjoyable activities and hobbies, socializing with others, and practicing mindfulness and relaxation techniques can also be helpful in coping with symptoms. Let's explore some coping strategies in more detail. Maintain a healthy lifestyle. A healthy lifestyle can be an important part of managing symptoms of schizophrenia. Regular exercise can help reduce stress, improve mood, and increase energy levels. Eating a balanced diet can provide the body with the nutrients it needs to function properly and can help regulate mood and energy levels. Getting enough sleep is also important for maintaining physical and mental health, and can help reduce symptoms of schizophrenia. Engage in enjoyable activities and hobbies. Engaging in activities and hobbies that bring enjoyment and satisfaction can be an important coping strategy for people with schizophrenia. Doing activities that you enjoy can help reduce stress, improve mood, and increase social connections. Some activities that can be enjoyable and beneficial for people with schizophrenia include art, music, gardening, sports, and other creative pursuits. Socialize with others. Socializing with others can help reduce feelings of isolation and loneliness, which are common experiences for people with schizophrenia. Maintaining connections with family and friends can be an important source of support, and joining support groups or peer groups can provide opportunities to connect with others who understand your experiences. Engaging in social activities such as clubs, volunteering, or taking classes can also provide opportunities for socialization. Practice mindfulness and relaxation techniques. Mindfulness and relaxation techniques can be helpful in reducing stress and managing symptoms of schizophrenia. Mindfulness techniques involve paying attention to the present moment and accepting your experiences without judgment. Relaxation techniques such as deep breathing, progressive muscle relaxation, and guided imagery can help reduce physical and emotional tension and promote relaxation. Coping strategies are not a replacement for professional treatment and should be used in conjunction with medication, therapy, and support services. Finding the right combination of coping strategies can take time and experimentation, and it's important to seek guidance from a mental health professional to develop an effective coping plan. If you or someone you know is experiencing symptoms of schizophrenia, it's important to seek help from a mental health professional. In conclusion, schizophrenia is a complex and challenging condition that can significantly impact a person's life. However, with the right treatment and support, people with schizophrenia can manage their symptoms and lead fulfilling lives. Early intervention, proper diagnosis, and a combination of medication, therapy, and support services can make a significant difference in managing this condition. It's also important to note that stigma and misunderstanding surrounding schizophrenia can make it challenging for people with this condition to seek help and receive appropriate care. Education and awareness can help break down these barriers and encourage more people to seek help. If you or someone you know is experiencing symptoms of schizophrenia, it's important to seek help from a mental health professional. Remember that there is no shame in seeking help, and with the right treatment and coping strategies, it is possible to manage this condition. Thank you for watching this video on schizophrenia, and we hope it has provided you with valuable information and resources.